money, that the US spends more money per person for health services than any other country in the world, including all these other countries I've just spoken about that have far better incomes than everyone else. So I'm not saying anything that the health system, that the medical profession doesn't know already. And I think that everyone is in agreement that this has to change. And part of where that change has to take place is where doctors are trained. So it has to take place in a medical school. The problem up until the last 5 years is that there were no new medical schools, and it's really hard to change an existing medical school. It's really hard to change the way you teach in an existing one, and so we kept in our system perpetrating the same outcome. But now there are some new medical schools that are starting, and we have the advantage of being one of those. So our group, including most of the people at this table, in fact all the people at this table, and initially a few others, and then a few dozen others, and then eventually about 100 people, really thought very hard about what we want our doctors to be achieving, say, 2 decades from now. And so here's our vision of our medical school, that every person in New Jersey, and eventually in the United States, regardless of race or socioeconomic status, will enjoy the highest levels of wellness in an economically and behaviorally sustainable fashion. In other words, we're also talking about decreasing the care of health care, decreasing the cost of health care. So how are we going to do this at our medical school? Well, we propose that the physicians we train in their delivery of the highest quality of care to all patients are going to act on their understanding that health and wellness occur where we live. That is, in the community, not in a hospital or in an office. And that kind of focus on health in the home and in the community is what drives well-being. Our students, so eventually our physicians, are going to serve and learn from socioeconomically diverse, including underrepresented minority populations, by making certain that they're well represented among our students, our faculty, our staff, and community. So the people that comprise our medical school will be eclectic in their backgrounds, and that's how it should be. We will collaborate with practitioners of the other disciplines of nursing, occupational therapy, physical therapy, to integrate their perspectives, their experiences, their tools, and we'll start this by teaching them as students. So the College of Nursing and the School of essentially Allied Professional Health are all moving out along with the School of Medicine. So there'll be a very large influx of students and professors from very diverse fields coming together on that campus, and we will all learn together. Because there are a lot of things that other professionals do far better than a physician, and that we want people that are going to be able to reach out to people in their homes and really know how to help them, to assist them in physical therapy in their household. Things that as physicians we're not trained in, but now at least we'll be well aware of what our colleagues can do and make sure that our patients are getting it in time. And we're going to embrace and model our professional and our university's Catholic roots of reverence for the human condition, for empathy towards suffering, excellence in medical care, and humility in service. One of our faculty members, the chair of neurosurgery, has just written a book about entitled Keeping the Me in Medicine. And it's just really important that as we train our doctors, that they have to remember that they as a person is what is interacting with that patient. And the compassion and the understanding will allow that person to communicate, to share, to confide in the doctor. And that's what we really need to be able to deliver the right care. The other thing that we must do is Our understanding, as a nation of adult learning has progressed significantly over the last 100 years. We really understand that the adult brain is very different from the child brain, and so there are very different ways you need to teach. But medical schools have been relying on the very outdated methods, that we continue to rely on lectures to transmit information. And we create artificial divisions between the so-called basic sciences and the clinical sciences, and we tend, as I've already mentioned, to neglect the role of other health professionals. And we really don't provide sufficient attention to the roles of behavior, and as I've already mentioned, to the role of community in impacting health. So our curriculum isn't going to do those things. We're making many changes in our curriculum.